for it's going to be almost 2 years.
Well, yeah, hi buddy. We spent 5 months to the day here at Lucille Packard in the neonatal intensive care unit.
About 6 years.
This is the second time she's been diagnosed, and after 5 years she got relapsed, so that's why we're here this time.
Okay.
Before his diagnosis, he was just like any other kid, just normal, just playing. And he one day started off with stomach pains.
Will was a micro-preemie. He was born at only 24 weeks and 5 days into my wife's pregnancy, at only 1 pound, 11 ounces.
My leg would hurt, and so at first we just thought it was a bruise or something, and then one day my parents took me to the doctor and they gave me an x-ray. The x-ray, they saw that something was there, but they didn't know exactly what, so they sent us up here, and that's when they told us.
Everything happened so fast, so they told us he had a tumor, which we didn't have time to process what that was, and then they told us that he had cancer, and right away they transferred us over here to the hospital.
That's very difficult because when you see things like this in the TV, you feel compassion for the kids, but you never feel that from the inside, that once it hits your family, it's totally different.
But for Nathan, this was the best hospital for him. The doctors were obviously great. They had a great sarcoma team, and they gave us all the information.
When you're here for 5 months, it becomes your home, and the doctors and the nurses and the respiratory therapists and the occupational therapists, and I'm sure I'm forgetting nutritionists, they all become a secondary family to you.
No oxygen.
No oxygen, nothing. It took about 22 months for we got there, right?
Thanksgiving. And you know you had a lean left cross when you were this
You
big.
used to be for us.
I like to thank all the people who support this hospital, because thanks to them, not only me and my family will be having more support in this area, that will be allowed to be for more families to come over with the same type of problems as mine.
From our perspective, 2017 can't come early enough. We're so excited for the hospital expansion, incorporation of things like natural light, private rooms for the patients. It's so critically important to help advance the healing for children here.
Especially with this hospital this size as what it is right now, I can't imagine what things can be done with even a bigger hospital for all of our children.
And I would like to thank all the construction workers, because even if it's raining or it's hot outside, they keep working hard to make it things made on time. Those are really deserve to say to hear our thanks for them. Thank you.
Thank you for building us a bigger and better hospital.